The heart, a tireless worker, beats to its own rhythm. This rhythm, a symphony of electrical impulses, dictates the contractions and relaxations that pump life-sustaining blood throughout our bodies. Electrocardiogram or ECG machines are the maestros of cardiology, capturing this intricate electrical dance as a visual representation. This graphical record, the electrocardiogram, provides doctors with a window into the heart's performance, revealing any irregularities or abnormalities in its rhythm. Imagine a conductor meticulously observing each section of an orchestra, ensuring harmony. Similarly, ECG machines allow cardiologists to analyze the heart's electrical activity, detecting a wide range of cardiac conditions. From arrhythmias, which are irregularities in the heart's rhythm, to myocardial infarctions, commonly known as heart attacks, ECGs play a crucial role in diagnosing and monitoring various cardiovascular diseases. Standard mode, as its name suggests, is the default setting for most ECG machines. This mode presents a comprehensive view of the heart's electrical activity from 12 different angles, much like having multiple cameras capturing an event from various perspectives. These 12 leads, as they are called, provide a holistic understanding of the heart's electrical conduction system. Each lead in standard mode represents a specific view of the heart, capturing the electrical activity from a unique angle. These leads are categorized into limb leads and chest leads, with the former measuring electrical potentials between the limbs and the latter placed on specific points on the chest. By analyzing the waveforms recorded from these 12 leads, cardiologists can identify abnormalities in heart rate, rhythm, and even structural changes in the heart muscle. Cabrera mode, named after its developer, Dr. Vital Miguel Cabrera Rubio, offers a slightly modified view of the heart's electrical activity compared to the standard 12-lead ECG. This mode essentially rearranges the leads, particularly the precordial leads, which are placed on the chest, to emphasize specific areas of the heart. Think of it as adjusting the camera angles to focus on a particular section of the orchestra. Instead of the traditional horizontal placement of precordial leads in standard mode, Cabrera mode arranges them in a semicircular pattern, starting from the right side of the chest and moving towards the left. This altered placement enhances the visualization of electrical activity in certain regions of the heart, particularly the left ventricle, which is the main pumping chamber. The primary technical difference between standard and Cabrera modes lies in the placement and orientation of the precordial leads. In standard mode, leads V1 and V2 are placed on the right side of the chest, while V3 to V6 are placed on the left side, essentially dividing the heart into right and left sides. Cabrera mode, with its semicircular arrangement, aims to provide a more continuous and comprehensive view of the left ventricle, which is crucial in diagnosing conditions like left ventricular hypertrophy and bundle branch blocks. While the lead placement differs, the overall interpretation of the ECG waveforms remains consistent between the two modes. The P wave, which represents atrial depolarization, the QRS complex, representing ventricular depolarization, and the T wave, representing ventricular repolarization, retain their significance in both modes. The difference lies in the emphasis on certain leads and the enhanced visualization of specific areas of the heart in Cabrera mode. Section 5. Clinical applications. When to use which mode. Both standard and Cabrera modes have their place in clinical practice, and the choice of mode often depends on the specific clinical scenario. Standard mode, with its comprehensive 12-lead view, is the go-to option for routine ECG screenings, diagnosing a wide range of cardiac conditions, and monitoring patients with known cardiovascular diseases. Cabrera mode, with its enhanced visualization of the left ventricle, proves particularly useful in diagnosing and monitoring conditions that specifically affect this chamber of the heart. For instance, in cases of suspected left ventricular hypertrophy, where the left ventricle is enlarged, Cabrera mode can provide clearer insights into the extent and severity of the condition. Similarly, in cases of bundle branch blocks, which affect the electrical conduction pathways within the ventricles, Cabrera mode can help pinpoint the location and severity of the block, aiding in diagnosis and treatment decisions. Section 6. Advantages and disadvantages. Weighing the options. Standard mode's advantage lies in its familiarity and widespread use. It's the standard for a reason, providing a comprehensive view of the heart's electrical activity that is well established and universally understood in the medical community. Its familiarity makes it easier for healthcare professionals to interpret and compare ECGs, ensuring consistency in diagnosis and treatment. Cabrera mode's strength lies in its enhanced visualization of the left ventricle, offering a more nuanced perspective on conditions affecting this crucial chamber. However, its less common use can sometimes pose challenges in interpretation, especially for healthcare professionals less familiar with this mode. The subtle differences in lead placement and the resulting alterations in waveform morphology might require additional expertise to interpret accurately. Section 7. Illustrative examples. Visualizing the differences. Imagine you're trying to listen to a specific instrument in an orchestra. Standard mode is like listening to the entire orchestra at once, giving you a general sense of the music. Cabrera mode is like adjusting the microphone to focus on that specific instrument, allowing you to hear its nuances more clearly. In a similar vein, imagine you're looking at a map of a city. Standard mode is like looking at a map that shows all the streets and landmarks. Cabrera mode is like zooming in on a particular neighborhood, giving you a more detailed view of that specific area. Section 8. Conclusion. Choosing the right perspective. The choice between standard and Cabrera modes in ECG interpretation is akin to choosing the right lens to view a complex landscape. Both modes offer valuable insights into the heart's electrical activity, and the decision to use one over the other depends on the clinical context and the specific information sought. Just as a photographer selects the appropriate lens to capture a particular shot, cardiologists choose the ECG mode that best suits the clinical scenario, ensuring accurate diagnosis and effective treatment for their patients. Section 9. Key takeaways. A quick recap. Standard mode. The default setting, providing a comprehensive 12-lead view of the heart's electrical activity. Cabrera mode offers a modified view, emphasizing the left ventricle, particularly useful for diagnosing conditions affecting this chamber. Both modes are valuable tools in cardiology, and the choice depends on the clinical context. Standard mode is widely used and familiar, while Cabrera mode requires additional expertise for accurate interpretation. Understanding the nuances of these modes empowers healthcare professionals to make informed decisions, ultimately improving patient care.